Hello everyone, welcome again to my channel. I am Dr. Zina. Today we'll be talking about the Lefort fracture classification. But before we continue, make sure to smash the subscribe button down below for more videos. Lefort fracture classification is divided into three types. We have Lefort 1, 2, and 3. Lefort 1 is known as horizontal injury. And as you can see in the picture, Lefort 1, it will extend up to the tip of your nose or until the philtrum. It also involves the maxillary teeth as well and the palate, of course. Whereas Lefort 2 is known as a pyramidal injury because it looks like a pyramid. It not only includes the maxillary teeth, the palate, the nose as well. All the nose is included. Also, the cheeks as well is included under the Lefort 2 type of fracture. Whereas Lefort 3 is known as transverse injury. Now, the least common type of fracture to be seen is Lefort 3, and Lefort 3, you can see it involves the eyeball as well. So the patient will have, instead of exophthalmos, which is bulging of the eyeball, he will be having inophthalmos, in which the eyeballs will be sunk inside. That is what I mean by inophthalmos. As you can see, this picture showing inophthalmos. So if the patient having his eyeballs are inside, sunk inside, okay, they appear as if they are tired. Of course, one side of whether right or left side, at which side is who got the hit on his face, will be having this diagnosis will be Lefort 3 type of fracture. Of course, the main cause behind any fracture you get on your face, it is if you get a very big hit on your face via car accidents. So car accidents is the most common cause behind Lefort fractures, whether type 1, 2, or 3, same thing. And here is the symptoms. The most common type of fracture is type 1. The Lefort type 1 is the most common one to be seen. The patient will be having swelling of the upper lip, buccal surface bruising, and of course malocclusion together with loosening of the teeth. These are the symptoms. But if you see the patient is having epistaxis, which is nose bleeding, then most commonly he will be having type 2 Lefort fracture, because we said type 2 it will involve all the nose, whereas only the up to the philtrum is the Lefort 1. So if it is nose bleeding, of course it will involve all part of the nose. In addition to that, we will have malocclusion and etc. and ecchymosis, of course, bruising. Now, of course, we cannot confirm our diagnosis only by seeing the patient and by his symptoms. We need to confirm it via a computed tomography scan in order to see the line of fracture. And finally, of course, the only treatment for all these type of fractures is surgery. That is the only option we have.